Morning Washington is here at the GW Center for Laser and Cosmetic Dermatology. I'm not sitting here for a treatment, but we're going to talk all about resurfacing laser treatments from the director and the expert, Dr. Pooja Sodha. How are you?
I'm great, Britt. How are you?
I'm good, and I'm eager to learn. Tell us all about these treatments.
I think that's just it. It's a treatment, and I love for patients to think of it like that. In this particular type of treatment, we are trying to address skin irregularities, whether that's a pigment irregularity or a vessel irregularity or a textural irregularity like fine lines or a little bit of collagen loss. And the whole idea is we're delivering energy in the form of heat into the skin, creating a little bit of an injury that then the body heals up and gets rid of those damaged cells and creates new cells in their place.
A lot of those things I feel like a lot of people go through. People are watching right now like, could be me or someone I know. How do we know that we're a good candidate for resurfacing laser treatment?
I think that's an excellent question, and I think what it leads to is the idea that we're all good candidates at some point in time. It's just about finding what's the issue we're trying to address that gives you the greatest joy if you come out of this treatment, and then also what's your life? You know, are you managing a job, kids, family? Are you out in the sun? Are you going to be home more? And we tailor an approach that fits all those parameters to give you the outcome that you need.
Personalized care. I like that.
It should be that way.
Yeah. If they're thinking, when should I get this started? When's the perfect time to start this?
I think that's a dual question in a way. Part of it's figuring out where you are in your life and sort of your cosmetic goal journey. Some of us are going to be in the I just want to maintain or prevent, and that's where using low energy treatments and using them infrequently through the year will help you do that. And then there are those who are needing more aggressive correction or want to target something a bit more clearly. And in that we might do a series of treatments to clear up that issue and then put you on a more maintenance path. In terms of the time of year, we always love to treat patients when they're not going to be out in the sun and aren't juggling lots of things. So it happens that that tends to be in the late fall and winter time. But if you can find the time any time of year, these treatments are safe all year round with the right protection.
I feel like you brought us here at the perfect time because we are right entering that season. People should really start planning. In order for them to do so, tell us some of the short-term and also long-term benefits.
You know, I think you're always going to see some improvement in terms of the texture and the quality of your skin. You're going to have a clearance of pigmentation. It's a little bit about feeling a bit rejuvenated. I think one of the nice things that we have found over the last few years is that there's a common goal that we achieve not just from a cosmetic standpoint, but now from a medical side. So there's research that came out early this year that if you get a couple of these treatments, you actually reduce your risk of non-melanoma skin cancer, squamous cells and basal cells, which are the most common in this country, by almost 50%. And if you can get a few more along the way, that potentially decreases the risk moving down the road. So now we're combining kind of an aesthetic benefit with a little bit of a medical improvement. Not just a little, a big one. So that's a nice combination for us dermatologists.
I love that you are making people feel good inside and out. Where do they get more information?
They're welcome to learn more about us on our website at gwlasercenter.com. There's a wealth of information online as well about these procedures that we're happy to clarify if they ever want to come in and see us.
I think it's a good time. It's a good idea. Thank you for sharing this information here on Good Morning Washington.
Thank you so much, Britt.
I appreciate it.